Hi, everyone. I'm Lindsay. I'm a research coordinator in the pediatrics department, and I am in IHPS. And I'm so pleased to be joined today by Dr. Lisa Rotenstein, who is a primary care physician, researcher, and healthcare leader whose work focuses on ambulatory care delivery, the physician workforce, and the intersection of the electronic health record with those issues. How are you doing today, Lisa?
Doing well. Thank you so much for inviting me to chat.
Course, I'm looking forward to it. And my burning question for you is, what are you currently working on?
So as you mentioned, I study a couple of main areas, and then I can tell you about some projects that I'm excited about in those areas. So first of all, I study the physician experience, but also the healthcare workforce experience. And what that means is we know that burnout and even depressive symptoms are prevalent among physicians, and we know that this issue has been going on for some time. But what we don't yet have an optimal understanding of is how to address the issue. And so a lot of my work centers around trends in this topic, and then evaluating solutions for enhancing the physician experience. I also do a lot of work around electronic health records and health information technology, both because it markedly shapes the physician experience, but it's also how we do our work in large part these days. And so it can give us a really great insight into physician workflows. So, for example, my studies have used EHR activity log data to show that primary care physicians spend the most time on the electronic health record, that their messaging and time on the electronic health record has increased more than that of other physicians since the pandemic, but that also, on the other hand, the time that primary care physicians spend on the electronic health record is associated with better quality of care in some circumstances. And so I sort of study those trade-offs and then the opportunities associated with new technologies. The last thing that I study is how primary care and outpatient care is delivered. So, for example, um, I have studied how behavioral health concerns are addressed in primary care, the time that is needed to deliver primary care, and then trends in the time that physicians are devoting to clinical practice versus other activities.
Hmm. Sounds like you have a lot of data to look at. The EHR specifically must be a treasure trove. Yeah, I think it's so important to look out for our physicians so they can look out better for patients. And I'm really curious to hear sort of how you got involved in this area of research, why you're interested in it.
Yeah, so it's a couple of main things. First of all, I'm a primary care physician and I believe really
Mhm.
deeply in the work that we do. And I think it is always important to have data to make the case for what we do and to use concrete data to optimize our workflows. I will say that one of the things that has really shaped my career trajectory was when I was in medical school and I was finding that a lot of my peers and mentors were burned out. I could see it and they were really struggling. And I was actually doing a joint business program where at the same time we were learning about how to take care of a workforce and how to motivate people and how to manage people. And we weren't having the same conversations in medicine. And so that led me down this path where one research question has led to another over time of what is the prevalence of burnout among our physicians? What are the factors associated with burnout? So, for example, recently published a study showing that incomplete staffing of our clinical teams is associated with higher rates of burnout and then intent to leave the job among physicians. And then how do we use new technologies to enhance the way we deliver care? So, for example, have conducted studies looking at virtual scribes, and now I'm conducting a large study looking at AI scribes to understand how that affects both physician workflows and then outcomes for our patients as well.
Yes, I can imagine the medical school business, that combination really sets you up nicely to approach this with a really unique perspective. Also, medical school reputation, doctor reputation. I mean, hopefully we can do something so it doesn't have to be that way. I think
Yeah.
I'm interested, so interested in what you guys are discovering. I'm also curious, my next question is how you hope your work will help change healthcare and healthcare policy.
So I see a few audiences for my work, and one of the audiences that's really important to me that I think sometimes we don't always do research for is on the ground leaders, like the people who are managing our clinics, the people who are organizing our clinics. That to me is like one of the main audiences for my research. What does that mean? So, for example, I have done studies looking at the clinic factors, the patient panel factors, the physician factors that are associated with differences in EHR time. What that study found was, unsurprisingly, that the more there is a team contribution to the orders that physicians place in the EHR, the less time you're spending on the EHR. And it didn't actually matter the specific staffing ratios within a clinic. What mattered was that somebody else was working with you on the EHR workflows. So that's the kind of data that I am trying to generate for clinical and operational leaders. I also have a policy audience to my research, and what that means is trying to quantify trends that are affecting the workforce in terms of how are physicians leaving the workforce? Are they spending less time caring for patients? And then what is the time that it takes them to care for patients to ensure that we are appropriately paying for that time and supporting that time? And then less decision makers, but I actually think that one of my audiences is just clinicians themselves. A lot of times people tell me that I have asked questions that they sort of felt in their daily practice. Um,
Mm.
and so that is sort of my goal. So the study that I did on work overload among physicians, but also other staff, that was published a couple of years ago, the impetus for that study was because I knew that folks in my own clinical environment were suffering from work overload after the pandemic, not only among the physicians, but among nurses, medical assistants, um, other healthcare role types. And so I wanted to create data evidence for what we were experiencing as a healthcare workforce.
Yes, I can believe that there's a lot of enthusiasm from your community of healthcare workforce for this kind of research. And yeah, hopefully this interview can help you get to those audiences just a little bit
Okay.
more.
Yeah.
And my very last question for you is open-ended, and that is, what's next?
I think the main questions I'm always asking is what works. And so there's a few studies that I have ongoing that I hope will help answer that. Um, So I have a large multi-site study funded by the Agency for Healthcare Research and Quality that looks at how different EHR optimization interventions, when used either alone or in combination, can affect a range of outcomes that are important. Burnout, physician EHR time, but also quality of care for patients. So specifically, we're looking at if one is using scribes or is using different team-based supports for managing the electronic inbox or is using automated replies to inbox messages. How do those different technologies in combination affect both physician and patient outcomes? That's one study I'm really excited about. And then, as I mentioned, I'm doing some work on AI scribes, both in terms of looking at their impact on time, but also understanding how they affect the physician experience and to what extent those two are correlated. So preliminarily, we're seeing that there's some impact on time, a lot of impact on experience, and so trying to tease apart those two different types of effects.
Well, personally, so excited to follow the research and see where it takes you. And I'm sure everyone else who will be learning about it will feel the
Mhm.
same. Thank you so much for your time today. It was a pleasure getting to know you, talk a little bit about your work. So thank you again, Lisa.
Thank you for the opportunity.